afternoon, I'm Dennis Ward. Thanks for joining us. We're live in our Ottawa studios today where we're putting the child welfare system in focus. We want you to join in on our conversation. Our phone lines are open. Call us toll-free at 1-877-647-2786. You can also tweet us at APTN InFocus. Use the hashtag child welfare. Before I introduce you to our guests, let's set the scene. Here's Brittany Hobson's story, which shows us how one woman is going to great lengths to protect her unborn child.
In Manitoba, it is estimated a newborn child is apprehended every day. The situation has become so dire, this expectant mother has decided to give birth in secret.
I'm feeling like I have to protect this birth from people who have the potential to sever my bond with my child.
The mother cannot be identified because her teenage daughter is currently a ward of the province. 2 years ago, she gave birth to another child in hospital. She says at the time she was forced to fill out paperwork detailing her involvement with Child and Family Services. She now worries her prior involvement will serve as a red flag.
Now I'm sitting here 2 years later and I'm going to have another baby. And I don't want to be in that building when that happens because I'm afraid they're not going to let me leave with him.
First Nations family advocate Cora isn't surprised to hear of this woman's plan.
We hear it every day because, Manitoba has the highest rate of newborn apprehension in all of Canada.
According to the province, there are approximately 11,000 kids in care, with 90% of those being Indigenous. These numbers will be the focus of an emergency 2-day meeting in Ottawa next week with Minister of Indigenous Services Jane Philpott. The minister will hear from Indigenous leaders, provincial and territorial ministers, and advocates. Morgan says she hopes to see some significant changes to the welfare system after next week's meeting.
After 150 years of the theft of our children, that, there's a meaningful commitment to, First Nations asserting jurisdiction over children and families, that we have opportunities and resources to be able to do prevention at the community level outside of the current system.
The Manitoba government has recently implemented a reform on the child welfare system.
We've got a big problem. That's why we're taking it on head-on as a government.
The new reform will see incentives for foster parents who wish to become permanent guardians. But for this mom, more needs to be done.
I think these changes are going to impact how the system operates and how foster families operate. And that's not enough.
Brittany Hobson, APTN National News, Winnipeg.
As I mentioned, we are live here in Ottawa for this week's edition of In Focus. That's because the federal government is hosting a so-called emergency meeting on the child welfare system. It's a system long criticized, and Indigenous Services Minister Jane Philpott has called it a humanitarian crisis. Joining us now here in our Ottawa studio is Cora, the family advocate for the Assembly of Manitoba Chiefs. Chickadee Richard, a First Nations grandmother from Manitoba who is attending the meetings this week as well, to add a grandmother's perspective to the discussions. We also have, from the women of the Métis Nation, President Melanie Omeniho, who will also be in attendance tomorrow. And in our Winnipeg studios, Grand Chief Jerry Daniels of the Southern Chiefs organization, who represent 34 communities in southern Manitoba. Thank all of you for taking the time to join us here today. We also had hoped to have Cindy Blackstock join us in studio. However, she is currently in transit on her way to Ottawa for this week's meetings. But we did speak with Cindy earlier in the week. Here is that conversation. Cindy, thanks so much for taking the time to join us. What are you expecting from the meetings this week?
Well, I'm not sure, actually. I'll be watching like many of your viewers, because I'm hoping that we're going to see the provincial and territorial commitment to implementing Jordan's principle. And I hope that we see the federal government absolutely committing to compliance on the tribunal's orders and for full commitment to the Spirit Bear plan, so we can eliminate all the inequalities that First Nations children, youth, and families experience. But I've looked at the draft agenda, and I'm not sure how those things are going to be achieved given the agenda, the way it's structured.
You've also expressed some concerns that premiers and ministers won't be on hand for the meeting. Why is that something to worry about?
Because when we think about the reasons that First Nations kids go into care, it's poverty, poor housing, addictions related to the multi-generational trauma of residential schools. So that goes further than just the Child and Family Service Ministries. We really need the premiers to embrace something akin to the Spirit Bear Plan at a provincial and territorial level, working with First Nations, Métis, and Inuit governments to make sure that those services respond to the kids' needs.
Minister Philpott has referred to the child welfare system as a humanitarian crisis. So are you expecting that there'll be some kind of federal government action that comes out this week?
Well, I certainly hope so. I've always measured the well-being of children as being our gauge versus announcements by any government. It really should be about whether on Saturday change has happened for kids that makes it more able for them to live the lives they wish to have.
The gathering will fall on the anniversary of the ruling by the Canadian Human Rights Tribunal. What are your thoughts on that, given that this meeting was announced months ago? It could have been held at any other time.
Well, I think in some ways it's proper that it's held on that day. It'll be 2 years since the tribunal handed down that decision that said that Canada was to immediately cease its discrimination. It hasn't done so. There's been 3 other non-compliance orders and another one pending. There's been some progress on Jordan's Principle, which is good, but more work needs to be done. And I think that having the meeting on this day really reminds all of us that we need to speak up. We need to make sure that those in power know that First Nations kids matter and they shouldn't have to wait any longer.
Cindy, we appreciate you taking the time to join us here on the show.
Thank you very much for having me, Dennis.
In Manitoba, 10,714 children are in care. As of March 31st, 2017, 89% are Indigenous. This is an increase of 683 children over the prior year's reporting, and that all comes from the government's own documents, numbers that portray a pretty grim story, a reality in Manitoba, a province also known for apprehending more than 365 newborns each year. Cora, I'd like to start with you as the First Nations family advocate and how you would describe the child welfare system in Manitoba right now.
Well, it's a crisis. Those statistics are the highest rates in the Western world, and we have an enormous amount of suffering. We look at the number of children, and we use the stat of 10,700, but that's also not accounting for children that are under extensions of care from 18 to 21, which would bring the number well over probably close to 12,000 children under the system. And the newborn apprehension rates, we have 4 times the number of newborn apprehensions of, say, Alberta, where we only have a quarter of the population. So it is a crisis. And in the work that we do at the First Nations Family Advocate Office, our office is still flooded. 2.5 years, we're still flooded with families looking for help and begging for their children.
Melanie, could you provide us with a Métis perspective on what you're seeing and noticing in the child welfare system?
The child welfare system is actually leaving a lot of our Métis kids falling in the gaps. I know Manitoba is a bit more responsive to Métis children and families than the rest of Canada. So we're going into this meeting trying to build relationships between our Métis Nation and the governments in Canada to ensure that Métis children that are coming into care and being brought into care have some responsibility back to their own nations and are connected to their own communities so that we can continue to work with them. Because as long as they're known as other Indigenous children or other Aboriginal children, when they don't get qualified as First Nations children, it means that those children don't receive the same kind of care and commitments that some of the other kids who we're working with in the system do. So we're hoping to become a delegated authority as part of the Métis Nation for Métis children, and we're going to be pushing for that with our provincial partners.
Chickadee, as a grandmother yourself, how has the system touched you?
I guess seeing all the children that are being apprehended and not being able to connect to their culture, their ways, and the stories, that I hear every day from the office, some of the caseloads that they have to work with the families. I see the harm that it's going to have in the future on the children. So it's not a very healthy, I guess, system for us. I mean, it's in place by the government and telling us how we should take care of our children. I don't really believe that they have the authority to tell us how we can take care of our children.
Grand Chief Daniels, the SCO recently hosted a summit of its own, a 2-day summit. Can you tell us some of the concerns and solutions that came out of those meetings?
Well, the concerns are pretty straightforward. We're talking about welfare, social welfare, family welfare, being underfunded for a very long time now. It's like many different issues in our communities, from education to health care. We're underfunded, $12,000 per child from the federal government. We need to see proper resourcing. We have the capacity to plan in our communities. Every community holds that authority, and we're working with the leadership in the communities and those who are examples of good work in terms of bringing children home and keeping our families together. That's the approach we're taking, and we want to go to Ottawa and say, resource us properly, and let's go towards a place that will translate into outcomes where children are coming home. And so we want to focus on that. And really, it's about housing. There's health issues, mental health issues. There's a lot. This isn't an issue that's in isolation. So we have to deal with it comprehensively.
Grand Chief, as you've heard, Minister Philpott has called it a humanitarian crisis. You've been meeting with the province. Do you think the federal government's doing their part to help solve this crisis?
I think everyone wants the same thing from what we hear. And we want to focus on the path to achieve that. And we've identified housing as a big part of that. If our children are going to come home, we need to have a home for them to come home to. And I mean, this is manufactured. It's not something that any of us ever wanted, and there's a history there for why it is what it is. But we want to focus on bringing our children home, and I'm hopeful that the federal government is with us on this, and what we're saying is enough time already. We have a tribunal ruling that's come down over a year ago now, and when are we going to see the resources to start bringing our children home?
Cora, are you seeing enough from the federal government here?
Well, I think the tribunal orders several things, and one of the things that we have particular interest in is the reform of the system. We have the worst stats in Manitoba, and we need the resources and supports at our community level. We need those prevention services coming into our First Nations outside of the system in order for our communities to address the healing and the needs of our First Nations people. So I think, and the Assembly of Manitoba Chiefs has a lot of work that it has done in order to bring our children home. They have a history of resolutions indicating that we need to work towards asserting jurisdiction over our children and families, and that the answers can no longer be prescribed, and that we need our own strategy for First Nations to take the lead. We've had 150 years where our children have been captured through the residential schools, 60 Scoop, and then now we have the current child welfare system. All along that way, there's been damage to the fabric of our communities, and we want to go back to those original ways of caring for each other, and we need the resources and supports to be able to do that appropriately. We want to assert that jurisdiction, and I believe that we have the ear of the federal government. The other challenge is we also are currently dealing with an imposed system from the province of Manitoba that has been really detrimental for the last 12 years, where the numbers of our children in care have dramatically grown. So, you know, there are more than just the responsibility of the federal government. We also have this provincial government, and so, and there's an issue across the country where we don't have consistency for our children, where we have systems that could be perceived as more superior. We have the rights to prove that we are in a humanitarian crisis, as Philpott has mentioned in many of her speeches most recently. But we have strategies. The Assembly of Manitoba Chiefs has a Bringing Our Children Home strategy. We recently completed in June of 2017 a comprehensive engagement process where we've gone into 23 First Nations. We've held town hall sessions in 4 urban centers in Manitoba. We've met with youth, we've met with grandmothers and grandfathers, and we know what we need to do. We just need some of the resources to be able to do that and to begin asserting that jurisdiction over the way things are done.
Melanie, what's your message, the message of the Métis Nation and others going into these meetings with the federal government and some other ministers here this week?
I think that we need to address this. I do think that it's a humanitarian crisis, as Minister Philpott has named it. And I believe that we need to collectively work within the Métis Nation and the other Indigenous nations to try to find solutions to all of these issues. These things aren't going to fix themselves, and I think that the province and the federal government all need to step up to the table and work with the Métis Nation and the First Nations and Inuit to make sure that we come up with solutions that are going to change the outcome. Otherwise, we're going to have another generation of residential school children under some other name.
Chickadee, can you talk a little bit about what role that you think community-based prevention has to play in fixing this system?
I think we definitely do need the resources and the funding to be able to do prevention, do some of the healing. And a lot of times, you know, from the grassroots perspective, they know what they need and want. You know, like Cora said, everything's prescribed to us. And why would we want to go to, you know, to the government to heal us when we ourselves know there's certain things within our own culture that can help us? There's people in our communities that overcome addictions that have done great things. You look at Senator Sinclair, where he is now. You know, he's come from a community too that has been broken. So we have ways. We know ways, and I believe that we have the capacity, like she said, you know, Cora, to be able to help our communities.
And I think we're going to go to a caller right now. On the line we have Catherine joining us from Toronto.
Hello?
Hi, Catherine.
Hi. I just want to say thank you to the speakers. This has been a continuous genocide on our peoples, and for myself, I am impacted directly of the Millennium Scoop. My 2 children are in care. They are Crown wards. I reside in Toronto, and I have done my utmost best to speak for them, as they have no voice in the foster and group home placements that an agency here in Toronto put them in. At this point, I am not allowed into the agency. I am banned. So to kibosh me as a First Nations woman who is trying to advocate for her children that have been physically, emotionally, spiritually, and mentally abused in so many different placements, it's really disheartening to see this. And I know that my sisters and brothers across this country are facing these problems as well as being silenced. But as we saw with a nationwide protest throughout Canada of Bring Our Children Home, I went into the agency and I asked the Director of Operations and Executive Director to listen to community. They listened to us, but they did not hear us. So for myself, what I wanted to get at is that I feel utterly failed by the ASN, by the chiefs who are to serve the people. And we, the grassroots people, the mothers, should have been extended an invitation to go to Ottawa on Thursday and Friday, because our voices matter. And whatever decisions are at the table that all of the involved parties come up with, we are the ones that feel the brunt of those decisions. So Chimigwech for listening to me, and I hope that this message is echoed to the people that are going to be at the table, and they keep in mind that they need to include us, because we are not going to allow for the millennium scoop to continue. Chimigwech, hi, all my relations.
Miigwech, Catherine, appreciate you having the courage to call in, and a number of things I'd like to pick up on there, but unfortunately we've got to throw to a short break, and then we'll come back and continue the conversation here on In Focus. Welcome back to In Focus. We're going to go to some social media now to hear what some of you are saying about today's topic. We had asked, how would you improve the child welfare system? And we had quite a few comments about it on our social media pages. Tori Fish wrote, they need to develop more strategies on how to keep the First Nations children to remain within the community, offer more training, workshops on parenting. Why must the child be taken out of the community? And last but not least, they have to start taking accountability for the vicious cycle of abuses. Dean Raymond Willier wrote, as long as our people are controlled by non-native people, the kids will never be safe from the Canadian system. When Michelle writes, we need more workers so they aren't burnt out. More workers equals less cases per worker equals better care. And Henry Belmore wrote, stop fixing the system. Let parents catch up to the system in place at least. If you keep fixing the system before anyone can catch up, it is not the system that needs fixing. Help the parents instead of the system. If you would like to add your opinion to our topic of conversation, here's how. Join our conversation by sending your thoughts in an email to infocus@aptn.ca, like our APTN InFocus Facebook page, follow and tweet us at APTN InFocus, or call in now toll-free at 1-877-647-2786. Before we get back to our guests, we were able to speak earlier today with the Minister of Indigenous Services, Jane Philpott, ahead of those meetings. Here's part of that conversation. Minister Philpott, thank you so much for taking the time to join us here in Ottawa today. What needs to be the outcome of this two-day conference, in your opinion, to make this a success?
Well, this is a really important gathering, and we have to come out of this meeting with concrete steps and commitments. So I know as a federal government, we're coming to the meeting prepared to make firm, concrete commitments as to what we will do, what we believe some of our next steps are in terms of a complete reform of child welfare as it relates to Indigenous children. And I'm certainly hoping that other partners are coming to the table also prepared to acknowledge the solutions and commit to doing the work necessary to change the system.
Earlier today, the provincial and territorial ministers put out a joint release saying that, and calling on the federal government to provide new funding for all of this. Is that something that you're going to be committing to this week?
Absolutely. I, in fact, already announced at the Special Chiefs Assembly in December that we would be committing additional funding. It will come out in Budget 2018 in terms of what the exact number is, but we have acknowledged that there are still gaps that exist. Some of those gaps are the work that we need to do to fully implement the orders of the Human Rights Tribunal, and we're going to come to the meeting. I will reiterate my commitment to fully implement those orders and to make sure that the funding is there that's appropriate.
You mentioned mentioned the ruling, and this meeting's falling on the anniversary of that ruling, and yet we've seen the federal government fail to comply there and fight this in the courts. Is something going to change there?
Well, I don't think we're fighting anything. I think we're working with partners, and in fact, I'm working very actively with the partners who are parties to the tribunal, the First Nations Caring Society, as well as the Assembly of First Nations and the other parties, and working quite directly with all of the leaders of those organizations. I've made it very clear to them that we want to achieve full compliance. We're literally going through order by order to make sure that we get the work done, including the funding that's there. It's all about collaboration. It's about focusing on the children, changing the system, investing in prevention, and we have a full commitment of our government to achieve compliance.
For some time now, we've been hearing about Indigenous women, and recently again having their children, having birth in secret. What does that tell you about this system?
You know what, it breaks my heart when I hear those kinds of stories, because it just speaks to the policies clearly not being correct when a woman has to hide away to give birth for fear that her child will be taken from her. It speaks to a system that doesn't acknowledge the necessity and importance of families being kept together, of recognizing the role of culture, the role of family, and needing to find ways that those family connections will be prioritized, and that in fact if there are challenges or reasons why a child might be apprehended, then let's address those causes. Let's address the poverty or the housing issue or the health issue that the parents might be facing, and find a way that we can support those families and support those parents so that they can keep their children with them.
Minister, we've been hearing in Yellowknife this week, where the National Inquiry is some testimony there from family members who are talking about the impact of the child welfare system. Do you see a link between those two?
Absolutely. There's no question about it. The data that we do have suggests that if you look at missing persons in this country, that children who grew up in foster care are heavily overrepresented amongst missing persons. Certainly that's the data that we've seen from Manitoba, for example. And there is a distinct link between those, and so that certainly emphasizes again the importance of really overhauling the approach and making sure that we get kids back with their families and hopefully avoid these very high apprehension rates that currently exist.
Well, Minister, we look forward to seeing what comes out of the meetings this week, and we thank you for taking the time to speak with us today.
Well, thank you very much for having me.
Melanie, listening to the minister speak there, do you feel that this is an Indigenous Services Minister that understands what this problem is and what needs to be done here?
We see that she's actually come out of the gate running to try to deal with the Indigenous services, and I'm hopeful that with the new change in the ministry to have two ministries and to try to deal with the fact that we need Indigenous services all across the spectrum that understand and identify issues specific to each of the Indigenous groups of people in a distinction-based process. We're very hopeful that that's what she sees and that's what she's doing. So she's demonstrated that in many of the issues that she's bringing forward, and when she speaks about the issues, she does seem to be informed and has been apprised of what's going on. So we are hopeful that it's going to go forward in a good way.
Grand Chief Daniels, I'd like to go back to some of the things our caller from Toronto, Catherine, had to say, and she had some criticism for the AFN and for some of the chiefs. Do you think some of that criticism is warranted?
Well, I mean, of course, we need to be responsive to the individual cases that are happening across the country. And I definitely think that the leadership is working very hard to ensure that those types of cases do not happen. We're working on some practical solutions, like the way that we measure risk. We need to change that. We need to bring it back into the community. We need families, the extended family, to be a part of that process. And we need people to step up in the communities to say who is ready to take responsibility. And we all have to take responsibility, and we got to do it together with everybody who cares about the health of the community. And I think that's the path forward, and hopefully these types of cases no longer happen.
Cora, Catherine also mentioned, that it should be, this is the Millennium Scoop, and that there should be a lot of parents, people directly affected should be taking part in these meetings, which I'm guessing we're not likely to see a lot of over the next few days.
No, but I mean, ultimately, the work that the First Nation Family Advocate Office does is in response to our families, and so we're kind of a unique service to our First Nations people in Manitoba when we work predominantly with parents and grandparents who are working and fighting to get their children out of the system. It's probably the children are the most important to hear from. And second to that, it would be the parents. And so both of those who are directly impacted by, this ridiculous system, that we need to be hearing from them. We need to hear their voices. And, one of our main goals coming to the First Minister's meeting is trying to bring some of that voice on behalf of the families that we work with. Because Catherine is important, her story needs to be shared, it needs to be told. And one of the issues is that mainstream society has to understand what's happening to these children, what's happening to these families. And the reality for our families is so far removed from mainstream society that people can't understand how detrimental it is and how torturous it is to have your children taken from you. One of the elders that we've worked with in the last couple of years has said the most violent act you can commit on a woman is to steal her children, and that's true. And we see it every day that our children in the system are losing value for life. Our parents are falling into complete hopelessness, and the system is guilty of breaking the bond between mother and child. And 90% of the parents that we work with, they come into our office in our first meeting with them. They all say the same thing. They're breaking the bond. And so,
Chickadee, as a grandmother yourself, what do you think when you hear of some of these mothers who are willing to go to the lengths of having their child in secret outside of a hospital to ensure that their child isn't apprehended?
Well, it's sad, but the truth is, there's things there in place already judging who we are as Indigenous women. So I think we have to go back to delivering our children back the way that it was, the midwifery back in our communities, and have the community there welcome the child the way that it was a long time ago. I was very fortunate. My aunties were there, my grandmother was there. And so we need to come back to that place, that we all are welcoming that beautiful sacred gift, that life, that baby, because we never know what that gift of life that they're bringing with them. So for me, the hospitals are pretty cold, and then for them to have an alert on a child, just by pure judging and saying, well, there's no parents around, or there's no support, there's no partner, or, they come from a child welfare system themselves. They don't even know the capacity of the mother, may have. She may have outside supports. She may be, our grandmother is somewhere behind her, but there's always something there that's an obstacle they want to create so that they can steal our children.
Grand Chief Daniels, when we're talking about trying to bring this to mainstream society, when 90% of the youth being apprehended are Indigenous, a lot of society doesn't have anything to do with this system at all, but they're in part how it's going to change. How do you bring these stories or get the concern on their behalf, I guess?
Well, you really have to just take a look at the system, take a hard look. Where are the apprehensions happening? Well, they're happening at Anchor. They're apprehending 75% of the children. That's where the numbers are coming from. So let's take a good look at how they're going about it. And we need to put a wall in place there that stops the apprehension. And it could be through family conferencing. is one path. One example of where they're trying to bring all the families and support people together to put together a support plan. But these things need to be resources, and we've been pushing for a change in the way that resources are made available for families and for children so that we can support the mothers, the grandmothers, and all of those who want to be a part of this process. And yes, it's been a long time coming. And there's a lot of other factors that play into this that are outside of child welfare, and we need to address those as well. And we're working with our treaty partners, and we're open to suggestions. But at the end of the day, the jurisdiction resides with the leadership and the communities, the First Nations.
I believe we have another caller on the line, Amanda from Huntsville, Ontario, who I understand has a question for the panel.
Hi, how are you? I'm just calling because I wanted to ask whether or not anybody is bringing up the systemic racism or systemic complaints made against Indigenous families. I do a lot of mediation for Indigenous families who have lost their children or that have had immediate apprehensions. And one big thing that keeps coming up is malicious complaints, either through systemic racism or through those kinds of avenues. I'm just wondering if anybody is going to address those issues.
Amanda, thanks for your call. Cora, you deal with a lot of the families. Is this something that you're hearing out there?
Absolutely. I mean, Chickadee referenced what happens at the hospital level, but we also have many issues where people are calling in complaints and children are being apprehended without proper investigation, and those are serious issues. I've responded to the hospital numerous times where a child has a medical condition or has been harmed, or not harmed, but has had an accident of some sort, and the hospital already, before they even investigate or see what's wrong with the child, they're calling child welfare. And so those are some of the systemic things. And we hear about families who have children who have maybe extra medical needs and the way that they are treated differently than other people at the hospital. We see things that are happening within schools where they're alerting child welfare, and Grand Chief Daniel spoke about Anchor, and that's in Manitoba, predominantly in Winnipeg. They respond to any of these kind of systemic calls, and majority of the time it ends up that children are apprehended. And so it's very serious, and it's really unfair too, because there's these expectations. One of the things that our office does as quick as we can is respond to the hospital when there's a newborn or a birth alert or a newborn apprehension. And so we see how the system has flagged this mother. So if an agency or a doctor alerts the system that this baby is in need of protection or potentially in need of protection, it's a human rights violation. Baby's not even born. The mother hasn't even had the opportunity to parent the child. And parents aren't even communicated that their child is at risk of apprehension. And CFS will show up at the hospital and take the baby on the spot. And there's no advance warning. Some mothers know that it's coming, but the whole process. And so if I, for example, were expecting a baby and there's concerns, there would be a form filled out indicating that Cora Morgan potentially is an unfit mother. That sheet is broadcasted throughout the whole province of Manitoba. And so my baby hasn't even been born yet, and they've broadcasted that I'm potentially not capable of caring for my child or protecting my child. And so, there's serious issues, systemic issues, and there's a multitude of other examples I could provide, but it is critical.
Melanie, we've got to go to break here soon, but do you think the color of one's skin or their last name weighs heavily when they go into the hospital?
It absolutely does. We've seen in other provinces as well where Mothers who have been a part of a system or an institutionalized process are immediately flagged when they come into the hospitals, or if they even bring their children in who've had an accident and they're suffering from injury. We've seen and experienced the same thing, where apprehension is the first course of action rather than trying to figure out what's really gone on, because accidents happen with children, but because of who they are judged.
And as I said, we do have to step aside and take one more break, but we'll be back to continue the conversation here on In Focus. Welcome back. Today we're putting child welfare in focus, and as I mentioned earlier, the provincial and territorial ministers this morning coming together and basically shifting some of the blame over to the federal government and saying that it is them who need to step up to the plate and provide more funding and resources. And Minister Philpott says that that funding pledge has already been made, and she'll reiterate it again tomorrow. But Cora, you're someone who doesn't necessarily believe that this is a system that needs more money.
I don't necessarily believe it needs more money. We do, in the sense that we need more outside resources like housing and infrastructure needs for services and programming at the community level. In Manitoba, we're quite unique. The Assembly of Manitoba Chiefs signed a memorandum of understanding with Minister Bennett and Minister Philpott. We want to work towards a system that, well, and I don't even like using the word system. We want to work towards this, those strategies to keep our children within the community, keep them within, extended family, and ultimately keep them within their family unit. And so we have a plan identified in our Key Women engagement, and so those are the directions that we want to go in to make sure that we bring our children out of the system. We believe that within 2 generations there should not be a need for the protection of children, and we need to put in action ways to address all the trauma and tragedy that we've faced for the last 150 years.
Grand Chief Daniels, you've been speaking a lot with the province of Manitoba and the minister there, and he is quite willing to admit, that they spend more money on apprehension than prevention. Is that something that the SEO has been advocating to see a change in?
Yes, we've been pushing for community-driven solutions. We truly believe that the solutions that need to be heard are from the grassroots up, from the families and the communities. And so I think the authority on CFS really needs to rest with them. The laws in which govern family affairs and those sorts of things are rest with the communities, and so we support that process. Absolutely, the federal government needs to provide funding and proper resourcing for things like housing. And none of our children should ever have to leave our communities, And there's a lot of examples of where we can do that in terms of even having where we cannot find placement in extended families. We should be having resources in the community so that the children, even if the situation comes in which that cannot happen, because we've exhausted every avenue, they should still remain in the community and provide support around that. I am a product of the CFS system. I was in the system for a very long time when I was younger. I've been in court with CFS agencies when I was 16 years old. I know about the system, and I want to definitely see change in it. And I can empathize with the children who are involved because I've been involved firsthand myself. And the only thing that's ever going to work is if the community is a part of this process. And if it's not driven by the community, no matter what, you can have the best solutions, and they'll never work unless the community is fully on side. And so it has to come from the community. The laws that govern CFS have to come from the communities. The First Nations have to drive this. And that's the only way forward, and the government just needs to resource it.
I'd like to hear from everyone on what needs to happen over the next few days to make this a success, for Saturday to see that a change will be coming. Melanie, maybe if we can start with you and what you think needs to happen here at this gathering to be a success.
One of the very first things that I'm going to say is that it's really time for both the provincial, territorial, and federal government to stop pushing the football back and forth between each other. We need to work collaboratively together. We don't care, and the children that are in care don't care about which face is standing there. They just need to have solutions to change what the outcomes are. So I'm hoping that we're able to come forward with strong outcomes that are going to have all of us participating in a role, not having paternalistic policies and legislation telling us how to take care of our kids, but having us as part of taking care of our children.
That's exactly what I felt this morning reading that press release from the territorial provincial ministers. It was like, here you go, federal government, your turn. Chickadee, for yourself, what do you need to see here to come out of this feeling good about it for yourself and for the families and those affected out there?
I guess having jurisdiction over how we take care of our children, the legislations, the policies. You know, I feel it's very important to speak for the grassroots, because that's where it came from. They say we had ways of taking care of our children. You know, my father himself was raised by my grandfather and my grandmother, and there was no CAS back then. They took care of him out of their own will and love. And so we had ways. We had customary care, kinship care. We had all those things in place, and CFS had disrupted it and disconnected it. And now they're trying to impose what customary care is supposed to be when we had it all along.
Cora, for yourself?
Well, I think we have to always be mindful of the children. You know, every day is critical. We're losing children every single day due to the system here in Canada. So I think we need to act quickly. We need to have systems of care for our children in place at our community levels. They have to be properly resourced, and like Chickadee said, and Grand Chief Daniels, we need to be able to assert jurisdiction within our communities, revive those original systems of care that we had for our families, and we have to make sure that prevention is something that is of real focus, because it's one thing to, we need to properly reform the system, and the answers and the solutions, of course, have to be ours as First Nations people. Parallel to that, we have to have those avenues for prevention so that we can provide those opportunities for healing for our families, and act quickly, because you know lives are counting on it. So,
Grand Chief Daniels, for yourself, what do you want to see happen over these next 2 days to on Saturday feel like something's being done here?
Well, they definitely need to make a firm commitment in terms of providing resources. These things can't happen in silos. We're talking about a system, a systemic system that has systemic problems with the Indigenous populations. And we're talking about healthcare systems, we're talking about education systems. We need to create opportunity in our communities. We need to give our young people a future they can believe in. And from there, I think you'll see that our people have always been had the values and the belief in themselves. We've really just had the door shut on us for a very long time on economic development. These things are very important. The welfare of our communities depend on income. They depend on education. They depend on a whole lot of things. And we've been shut out for a very long time. And yeah, we want to deal with the welfare and our children, but we need the resources, and we need the governments to stop denying us access to the market, so that so our families can live prosperous and support one another more effectively. And that's really why this is occurring. It's a systemic issue. It's not simply just welfare. And I hope that the feds and the province understand that, and from what I've heard is that they do, and hopefully these things can happen in a very short period of time.
Thank you, Grand Chief Daniels, and we do all hope for the best over the next few days. But like you mentioned, poverty, housing, these other things, and as Cindy Blackstock said, we're not going to see those ministers at this meeting over the next few days. Unfortunately, that is all the time we have for today's show. I'd like to thank our guests for being here, Cora Morgan, Chickadee Richard, Melanie Omeniho, and Grand Chief Jerry Daniels. Thanks to all those who commented on Facebook and Twitter pages and called in as well. And you can watch this episode. It'll be posted on our website, aptnnews.ca, later tonight. And stay tuned for the news. We'll also be covering the emergency meeting here in Ottawa over the next few days. Thanks so much for tuning in. I'm Dennis Ward. Have a great day.